Millions more people in the U.S. could soon be eligible for a coronavirus booster shot. A CDC panel voted in favor of recommending additional doses of Johnson & Johnson and Moderna's vaccines, but the agency's director still needs to sign off on the decision. Meanwhile, the pace of first-dose vaccinations has been falling for 14 consecutive days. It's now down to about 180,000 shots per day. So far, just over 66% of the population is partially vaccinated, and more than 57% is completely vaccinated. Meg Oliver leads off our coverage from New York City. Meg?
The CDC Advisory Committee's recommendations set the stage today for Americans to receive the Moderna or Johnson & Johnson booster as early as Friday. We also learned the CDC will not change the definition of fully vaccinated. Those who received 2 doses of Pfizer or Moderna or 1 shot of Johnson & Johnson.
Tonight, the CDC advisory panel recommended Moderna recipients who are 65 and older or at high risk because of their job, living situation, or underlying health conditions should get a booster shot at least 6 months after their second dose. The panel also recommended that any J&J recipient 18 or over get another shot at least 2 months after their first one.
Do boosters get us closer to the finish line of beating COVID or simply managing it?
At this point, we're not sure whether this gets us to the finish line or whether we'll need additional doses in the future.
As for which shot to get, the panel did not give a recommendation on whether anyone should stick to the brand of their initial vaccine or mix and match, leaving it up to the individual.
If you got the Johnson & Johnson vaccine, you're getting Pfizer and Moderna as your second dose, you get an enhanced boost of your immunity.
Okay, you ready? Yeah.
The late day vote now puts the final decision in the hands of CDC Chief Rochelle Walensky, who is not bound by the panel, but is expected to follow its recommendation. Today, the fallout continued in New York City over the mayor's new vaccine mandate for the city's more than 300,000 municipal workers who face mandatory unpaid leave if they are not vaccinated by the end of next week. With barely half of all firefighters vaccinated, there is already talk of firehouses closing.
The chiefs are hearing from members that are saying they will absolutely not comply. And what happens in 2 weeks will be anyone's guess.
COVID has been the leading cause of death among firefighters nationwide for the past 2 years. Here in New York City, if they start closing firehouses, the mayor says they have a contingency plan in place to protect the city. Lana?
All right, Meg, thank you. For more, I want to bring in critical care physician, Dr. Lakshmana Swamy. Dr. Swamy, great to have you as always. A CDC panel has now voted to recommend Johnson & Johnson and Moderna's booster shots. What did these experts discuss Thursday, and what did you make of their decision?
Yeah, thanks for having me, Lana. I think this is what we were kind of expecting and waiting for. I think Moderna's kind of following suit with Pfizer. We're expecting people, the same kind of groups, to be eligible. I think it's important to emphasize that shots into arms that have not received any, the unvaccinated, count for a lot more for everyone. I think the one distinct point to make here is those 15 million or so who've gotten J&J, because I think here mixing and matching actually matters more than in other cases, and an mRNA booster, Pfizer and Moderna, probably does give a good bit of extra protection for them.
Well, Pfizer's late-stage trial data shows that its coronavirus booster restored full protection against the virus. The company says that its third dose is more than 95% effective. I'm wondering, does this data apply to all recipients? Are there variations within different populations? And does that ultimately mean that everyone is eventually going to need a booster to achieve maximum protection?
Yeah, I think it's a great question. I think that, these studies, more and more data come out every month, and it'll be important to follow that. Why? Because it's a very different case if you're talking about someone who's elderly, who's immunocompromised. Those are the people that really need the extra protection to make sure that they really are still protected. Whereas, many of us who are younger than that, under 50 certainly, it's hard to say that there's really a benefit right now to getting a booster or that there will be in the future. There may be. We should wait and find out before rushing to get extra shots there.
Well, the pace of first dose shots has been slowing for 2 weeks straight. Is that to be expected at this point, or are you concerned?
I think it's so hard to hear that, right? I mean, we want to get more and more shots into first dose shots into arms. And I think that there's, every extra shot is someone else that's partially vaccinated, someone else is getting fully vaccinated. It is hard to hear that slowing down. I think we really need to look at our nation's public health and medical infrastructure now. I want people to go to their doctors and say, hey, I've been hearing about this. I have some concerns. Let me ask you about it. Addressing it at the misinformation, the disinformation at the level of, doctor and patient is really where I think we need to be now to get over that finish line of getting everyone else vaccinated.
A new CDC analysis linked the Delta variant to higher odds of breakthrough infections. Dr. Swamy, we're hearing about so many breakthrough cases. Are these still considered rare? And are recipients of certain vaccines at greater risk? And does that all feed into this idea of the necessity of boosters?
Yeah, I think this is what a lot of people are worrying about. They're saying, I don't know, it looks like there's breakthrough infections happening at a not insignificant rate. Does that mean that those people weren't vaccinated enough, aren't protected? Not exactly. The key here is who's getting in the hospital, who's getting really sick. And I think what we're seeing, by and large, and certainly I think this is true in my clinical practice and those of many of my colleagues, if you're fully vaccinated, you're probably not ending up seeing me, an ICU doctor, right? And that's what's really important. So breakthrough infections are going to keep happening. That doesn't mean the viruses don't work. Far from it. It's showing that you're getting a much milder case. And that's the key. The key is to keep people healthy out of the hospital. And I so hope in the future, we can keep people from transmitting it. We're not there yet, which is why all those other measures like the masks still matter.
That's also a great reminder, too, even for people who may feel healthy and invincible, that they also, if they're concerned about the people that they love and that they're surrounded with, the best thing to do for them is vaccination. So as of Thursday, the U.S. has donated 200 million vaccines to more than 100 countries around the globe. The president has pledged that the U.S. would be a, quote, arsenal of vaccines for the world. I'm just wondering, I want to check back in. How are we doing on fighting this at a global level?
I'll be honest, I don't think we're doing as well as we could be. I think, India passed a huge milestone recently with its impressive vaccination rate. But look, we're seeing effects on supply chains across the world, right? And for example, we just heard about, now medication shortages. What's next? This is the effect of a global pandemic. That's why getting boosters into arms of otherwise pretty healthy and protected people shouldn't be the spotlight. The spotlight should be getting first doses across the whole globe to prevent this virus from mutating, from spreading, from shutting down things that really affect us here at home in America.
Dr. Swamy, thank you so much for joining, and thank you for all that you do.
Thanks so much for having me.